So, the topic I want to talk about today is, can you be a nurse if you are shy? I think this is actually a pretty common question that people have, whether they're thinking it to themselves or if maybe one of your professors have even said this to you. Because I actually had a friend when I was in nursing school where the professor told her, like, this is not a good profession for you, like, you should do something else. And I thought that was just like so out of line, like, were you to even be saying that to her? But I massively disagree with that. And this video is going to tell you why I think that, or these are different things you can do with the nursing degree, even if you're shy. So, the first thing kind of sounds counterintuitive, but it's to do acute care nursing. So, yeah, of course, I feel like when most people think of nursing, they think of like the emergency room nurse, like people are dying, you're coding them, like all this kind of stuff. But it's not always that intense, and it depends on what unit you work at. So, I would say if you really want to stick it out and do nursing, like acute care nursing, for 1 or 2 years and just like get your time in, I think that you should try to do night shift. And the reason behind this is because night shift typically is slower and people are sleeping, unless you work in the NICU where they're just like babies and they're awake. But most of the time, like especially if you work with adults, like or kids, like they might be intubated, so maybe you won't have to speak to them that much. And I also think, like, when I worked in the ICU, I was not handed as many patients as I was in med surg, and so I thought that was really helpful because I was able to really take care of every patient individually, and that made me feel really good. Because I feel like sometimes in med surg you're just like stressed out about actually completing the tasks and like going to rounds and all these things, but I feel like in the ICU, because you only have like 1 or 2 patients, that you're able to really dedicate more time to them. So I think if you're on the shyer end and you're like a new grad and you're nervous about like learning how to be a nurse, I think it's somewhat like less stressful. And not because the patients are not sicker, because they definitely are sicker and there's a lot more drips and things going on, but I think that you're able to dedicate more time to every single person and really learn. So that's just what I think, but take it with a grain of salt if you don't agree. So night shift ICU. And then I would say, like, if you really are shy, like maybe you have really bad social anxiety, maybe just try to go on an SSRI while you are doing nursing, like acute care nursing, or go to therapy. Because I mean, I think a lot of nurses actually are on meds, and it's not really spoken about very like outwardly, but I think there are a lot of nurses that need medication to get through this. So I think that if you want to just do that, it might be worth it for you just to get the experience. And also, I think that you could do this because I also am doing this. Like, I have always been shy my entire life. I'm on the timid end, and I've been an acute care nurse for 5 years, so it's definitely possible. So yeah, that's like the first thing. The second thing I would say is being in the OR, because the OR, I mean, most of the time they're anesthetized, so like the patients are not going to be speaking to you, and I'm sure over time, once you learn what to do, maybe it becomes less stressful. But I'm sure, like, I mean, every job is stressful. Like, I'm sure the surgeons and the other nurses, like, sometimes it can be intense, but I think being in the OR and having that like repetitive action, it might be helpful. And the third thing that I have listed, so if you see me looking to the left, it's because I have like a list of things. But yeah, the third thing I wrote is mental health nursing. And the reason I think this is because I feel like a lot of people who are shy tend to be like also really like great at listening, and they're compassionate, and they're really understanding of other people's struggles because they themselves struggle a lot. And I feel like that would be helpful if you're working with patients that need like psychiatric care, because I feel like a lot of people just feel like misheard. And so I think that you would be a great asset in working in this field. So yeah, I think that would be a great one. And then the obvious one that I wrote is just like doing a clinic job, like whether that's school nurse, you could do aesthetics, adult dermatology, like literally anything outpatient, because you're still doing clinical care, but at least like the time is, it's like a lot shorter, and I'm sure over time you get to know your clientele, so like it's a little more predictable. yeah, I think it's just a lot less intense because they don't need to be hospitalized, so it's not like life or death most of the time. So I think that'd be really great to start out and still get clinical experience. And then the next thing I wrote is research nursing. So I think research nursing is great if you're like really book smart, if you're in nursing school and you do really well in your classes and maybe better in your classes than like clinical. I think this would be a great option because it's more just like science based, like evidence based research, doing all that kind of stuff. So yeah, either if it's like a research nurse or I think it's called a CRA, but like I think you could use your nursing degree and like maybe get an entry level position to do research, but I think that'd be a great option. And I actually, like, I don't know her that well, but I know of someone that, like, she got her BSN and then she went, like, straight to a PhD program and, like, did research. So, like, she never even got clinical experience and she was able to have, like, a completely different job using her nursing degree. So I think that's great. So I would say if you're really book smart and you like research, then you should go for it because it also can be really lucrative, like especially if you work for like maybe a hospital doing research nursing, but then you like slowly move into pharmaceuticals or just like any company like that. It can be really lucrative. So I would really recommend that. And I do know that some of these jobs, like I think some research nurse positions require you to have clinical experience, but I'm like the CRA I was talking about, like I think you could do that like straight off the bat. So maybe just research and see like which ones you need experience, or even if it says you need experience, like apply anyway. What's the worst that could happen? So you have a nursing degree, it's not like you learned nothing in school, so I think that you should still try for it. And the next thing I wrote is community health nursing. So I think this is great because you're like working with the community in more of like a one-on-one setting. Like it's not always one-on-one, but I feel like it's like smaller groups and the people are not even actually sick most of the time. It's usually like preventing disease, so like giving vaccines or going to churches and working with the government. Like some of these jobs can actually be really cool. So I don't know that they make a ton of money, but I think it's still pretty rewarding if that's something you want to do. The next thing I wrote is home health nursing. So I think this is great because it actually is one-on-one most of the time, and there are actually a lot of new grad positions because when I was a new grad, I actually saw that as an option, like a lot when I was researching like new grad positions. So yeah, I think it's still clinical care, but you're like doing it one-on-one and you can learn. I'm not too sure like if you're a new grad if like someone would come with you in the beginning, like I'm sure, but yeah, I think that'd be a really great place for you to learn, and then you can actually apply it to individual people instead of running around in circles. So I think that's great. And then basically my last bullet point was that a lot of non-clinical jobs actually require nursing experience, which is kind of sucks. But like I said, you could either just do acute care for 1 or 2 years and like suck it up and then never do it again, or you could do like I said, the clinic job, because that's still clinical experience. Or you could just find someone and like get lucky and do like entry level positions and work your way up, like if you know people and stuff. So yeah, the reason why I like thought to talk about this and like even make this list is because like I said, I had a friend actually that was in nursing school and the clinical instructor told her that, and I just thought that was horrible. And I think there's one thing, like if you really just don't want to be a nurse and like you switch your major, fine, like obviously you can do whatever you want, but I think a lot of people think that you have to be really extroverted or like people person or whatever to actually succeed, and that's not true because there's so many types of nurses that like you can't all have the same personality. Like I was saying, like mental health nurses versus like I don't know, like cardiac ICU nurses. I really would argue that you don't need the same personality to do those jobs. So yeah, I think that if you are on the shyer end, or like you have a lot of anxiety towards nursing and you're like maybe you're a junior or senior and you're about to finish nursing school and you're like scared, I think that you should still do it because even just like having a degree that's completed, you can still switch that to like business degrees or just like literally anything else. Like even if it has nothing to do with nursing, like pretend you don't want to do nursing at all, you could do like entry level business jobs and work your way up there. Like at least if you have a degree, like I would say if you're almost done, like don't do the hassle of getting a whole other degree and like wasting your time and money unless you have the finances and time for that. Like at least in my opinion, what I would do is just work your way up or try to find someone to hire you into a different field. So, yeah, I think that if you want to be a nurse, you're still able to do it even if you are not like a typical nurse personality.